Hey, Dr. Jerry Williams with Urgent Care 24/7, here to talk to you about some important information regarding the COVID-19 vaccinations in kids. So, the CDC and the American Academy of Pediatrics are recommending that children 12 years and up be vaccinated with the Pfizer vaccine, which is a series of 2 injections, 3 weeks apart. And you've probably heard about that on the news. But what's interesting is that the World Health Organization has now just come out and changed the position, not recommending COVID-19 vaccination for kids and teenagers. So we've got these very influential health organizations with conflicting recommendations. So I wanted to weigh in a little bit on this topic because, first of all, we're getting a lot of traffic on our websites about this issue, but it's also in the news a great deal, and I think it's important that you understand what's at stake here. Now, first of all, immunization is a very personal decision, and in some cases, with some folks, a very politically charged decision or topic. But I want folks to understand what the reasoning is for immunizing kids for COVID-19 when COVID is such an incredibly benign illness in children. So let me explain. First of all, we're never going to get rid of COVID. COVID is endemic now. It's in the environment worldwide, and it's not something we're going to get rid of. But we certainly want to do everything we can to keep it in check. And ultimately, maybe one day, though it's doubtful in my opinion, that we would get herd immunity, which is when you have enough immunity in the population to where the virus essentially doesn't have a place to land and becomes quiescent because of a lack of hosts that could be infected. But, and herd immunity has always been the goal, though we're a long way from herd immunity, and what it will take to achieve herd immunity is another topic of debate, whether it's 70% of the population or 90+% of the population. And Dr. Fauci has been criticized for how his opinion on that percentage to achieve herd immunity has varied over time. But there is an important reason to immunize the population that you need to understand. And it doesn't have to do necessarily with herd immunity, but what it has to do with is every time an individual is infected with COVID-19 or any other virus for that matter, when the virus replicates or reproduces, you have this huge bloom of viral load in the infected individual. Well, the more times a virus replicates itself, the more opportunity there is for a mutation to occur or mutations to occur. And a mutation is a change. Now, not all changes in the genetic material of any organism, or a virus for this matter, and as in this case, is necessarily a change that would make the virus more virulent or more easily transmissible or more deadly. Some changes could occur in the virus that aren't to the benefit of making the virus more dangerous. But in that case, those mutations would not have the opportunity to get spread because they're not advantageous from an evolutionary perspective for the virus to be more dangerous and more virulent. But in the case of mutations where the virus becomes more virulent, more dangerous, those mutations would obviously be more able, by the increased virulence of the virus, to be spread. So when you immunize an individual and they're less likely to become infected, you're reducing the number of hosts that can be infected. Therefore, you're reducing the number of replications of the virus. And when you're looking at the billions, trillions of replications that you can reduce by immunizing the population, you're reducing the number of replications. Therefore, you're reducing the number of opportunities for dangerous mutations that could increase virulence or deadliness or infectiveness of the virus. And as much as we can reduce the opportunities that the virus has to mutate into a more dangerous state, the better off we are. Now, we certainly can't make the cure worse than the disease, and there's been a lot of concern over heart complications surrounding the COVID-19 vaccine, and it's something that we do need to keep an eye on. Obviously, can be a very dangerous side effect, but fortunately, the myocarditis and pericarditis complications of the heart associated with the COVID-19 vaccine have been rare. So again, very personal decision on whether you immunize your child or not. World Health Organization says not enough evidence yet to recommend vaccinating children. American Academy of Pediatrics, Center for Disease Control, CDC, are saying to immunize children 12 and up with the Pfizer vaccine. But now you understand, at least on both sides, for and against, what the concerns are. Number one, again, to reiterate, immunization decreases the number of hosts that the virus can infect, therefore cuts down on the opportunities for the virus to mutate and become more virulent or more deadly. And for those that don't feel that it's safe, and the World Health Organization concurs with these folks and says we don't have enough evidence yet, the argument is not a serious disease in children, and we do have risks of what can be serious side effects. So those are the important points that I wanted to address today, since the World Health Organization has changed their position on immunization in children. And the fact that it affects or contradicts what the CDC and the American Academy of Pediatrics is recommending, I thought it was at least an important topic that we should have a discussion on. So I look forward to talking to you again, chatting with you again on another medical topic. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.